You're listening to the Cancer Assist podcast. Wherever you are in your experience, we are here to provide help and hope as you navigate cancer prevention, treatment, and care. Hosted by Dr. Bill Evans and brought to you by the Cancer Assistance Program. Help when you really need it.
So welcome to the Cancer Assist Show with Dr. Bill Evans, that's me, and my guest today is Sarah-Eve Loiselle, who is an employee with Abbott, and she is a registered dietitian and a nutrition science associate at Abbott. And welcome, Sarah, really great to see you on the screen here. You're in Montreal where it's snowing, I gather. But really great to have you here to talk today about a topic that doesn't get a lot of attention, dehydration. But maybe before we jump into it, maybe you just say a few words about yourself, how you got to be a registered dietitian, where you did your training, and what you're currently doing at Abbott.
Thank you, Dr. Evans, and thank you for this invitation. It's a great pleasure to be here with you and discussing hydration and dehydration. And yes, I'm recording live from Montreal, and it's a very snowy day today. And in fact, I did study nutrition in Montreal. I did my bachelor's degree at the University of Montreal, and I did my master's degree at McGill University. And I worked for over 12 years as clinical dietitians in a hospital, mainly at the McGill University Health Center. And I had the pleasure to work with a lot of oncology surgical patients in my practice, more specifically upper gastrointestinal cancer, such as esophageal cancer, gastric, and lung. And now I work at Abbott, and I'm a nutrition science associate, and it's a pleasure to talk to you today.
Well, I noticed in looking at your CV online, or at least what you've put online, you really have had a lot of different experiences, not just in oncology, but nutritional assessment, prehabilitation, childhood obesity, health behavior change. You've had a wealth of experiences and been active in research during the earlier part of your career. So I think you've got a lot of information to share with us today. So let's dive in to this topic of dehydration. And maybe some of our listeners might wonder, well, how important is this in managing a cancer patient? But in fact, it's pretty common, and it's common both because of the treatment for cancer and sometimes the cancer itself. And perhaps to start, we need to define what dehydration is, and maybe just an interesting couple of facts before I let you provide a definition, to think about the fact that our bodies are largely water. Like 60% of a man's body weight is water, and about 55% of a woman's weight. And it's even worse when you think about your brain. It's about 90% water, and the heart and so on, about 70%. So we're made up of a lot of water, and when we get out of balance, of course, we can have a lot of symptoms. Yes. So maybe you could just tell us a little bit about how you define dehydration and why it's important.
That's a very good question, and I think it's very important. Even more important for patients who are going through oncology treatment, and please feel comfortable to add your doctor experience working with those patients as well. But I think dehydration will happen when there's an imbalance between the needs and what the person is able to take. So if the needs are elevated and the person is not able to meet those needs or is losing a lot of fluid, this is where we have an imbalance, and people can be dehydrated. And I think there's many occasions during treatments, oncology treatments such as chemotherapy, radiotherapy, where a patient could be dehydrated, mainly from the multiple side effects that they could have. It could be diarrhea, vomiting, it could be having nausea, pain, loss of appetite, inflammation of the mouth, painful swallowing, weird taste in the mouth or bad taste in the mouth. So I think all those factors can affect the consumption of not only food but fluids as well.
So part of the reason for dehydration is you're just not able to take in enough, and you mentioned a variety of reasons why our cancer treatments might cause that. Certainly a lot of the drugs are nauseating. That's unfortunately too well known in the community that many of the chemotherapy drugs in particular are nauseating. But the cancer itself can be responsible, can it? Because if it's, say you mentioned you had experience with esophageal cancer patients. Well, if your swallowing tube's obstructed, then you can't take in the usual amounts of water. Or if your bowel is obstructed from colon cancer or ovarian cancer causing adhesions, then you again can't take in the necessary fluids. And when you think about these fluids that we're taking in, ultimately go into different parts of our body, into the cells. About 2/3 of the water that I mentioned is actually in cells. 1/3 of it's in the blood vessels and in other locations. So a consequence of not having the right balance is that you'll lower your blood pressure, and your cells won't work properly because they have an imbalance of fluid versus other things that are required to keep what we call homeostasis within the cells. So that can lead to a number of different signs of dehydrations, right? So you might just tell us what those signs might be that we'd see in a cancer patient who's become dehydrated.
Sure. I mean, like you said, water is vital for everyone, and it's very important and very, I think, well regulated in the body, and an imbalance can cause different symptoms. The first symptoms that I think comes to mind in general would be thirst, but the science is telling us that if you feel very thirsty, the chances are that you're already dehydrated. So thirst, yes, but there are other signs. It could be headache, dizziness, crankiness. One sign that I really like to tell my patients when I used to work at the hospital was to look at their urine, how much output, how much volume of urine, and the color. So if there's less urine than usual and the color is very dark, that could be an earlier sign of dehydration. And then a later sign of dehydration could be the dry skin. So when looking at your skin and pinching your skin, if it doesn't come back to its place, it could be a sign of dehydration. And if the vital signs are measured by a healthcare professional, it could be low blood pressure as well. Do you have any other symptoms you would like to add to this list?
Well, I think one of the common ones that we see too, but it's confusing in the setting of cancer, is just fatigue.
Yes, true.
People feel more tired and draggy, and sometimes that's hard to differentiate from just having cancer and going through treatment. And that's why it's important to look for some of these other factors: lower urine output and dryness of the mouth, thirst, and blood pressure that may have dropped. So yeah, it's really, really important. And in the worst case scenario, if it's not looked after, and it really can become an emergency, right?
Absolutely.
So you can have things like seizure, you can go into coma, and kidneys can shut down. So it's not an inconsequential thing to become dehydrated, particularly if it goes unrecognized or someone doesn't come into the hospital for care, or family and others have recognized and started hydrating the patient better at home. So it's really quite important. And the body works very hard to try and keep us well hydrated. It's a pretty complicated
Yes.
process where as we have less fluid, and particularly less water in our system, there are particular sensors in our brain and the hypothalamus that release a hormone called antidiuretic hormone, and just like the name says, it works on the kidneys to hang on to the water, right? So these mechanisms are working to retain it. At the same time, the kidneys put out other hormones, and it's a kind of complicated cycle of something called renin that gets put out, and ultimately a hormone called aldosterone that helps to retain salt, or sodium, so that between the two, sodium and the water, the body's working hard to maintain it, but sometimes if we're just not taking in enough, those mechanisms aren't enough to keep us in a balanced state, and that's when we need to try and intervene. And so we need to talk a bit about what are the options for helping a person who has become dehydrated. I guess we could say, first of all, if it's just mild dehydration, there are certain things we could do, but as it gets worse, the interventions become a little more maybe hospital-based, a little more aggressive because they need to be. But in the earlier stages of dehydration, what would you recommend to a cancer patient?
Yes, you're absolutely right. Hydration can be difficult, and it can be mild, moderate to severe. And when it's mild and a patient is at home and able to consume some food and some liquids, especially in the cancer population, we always say, all the choices are good. Anything that will go down well, anything that the patient will tolerate well, that will like the taste, that will not worsen the nausea if present. So it could be, of course, water, but juice, it could be milk, it could be smoothies, soda, any types of flavored water or drink. It could be soups, it could be tea, coffee, ice cream, popsicles, because those melt at room temperature, so they're considered like liquids. It could be Jell-O as well, because again, without the gelatin, it would be like a juice. And it could be oral supplements, milkshakes, and so really any liquid that will go down well, that the patient that will tolerate well, that will taste good to them. Any liquid is good, and every sip count when for a patient that's going through a cancer treatment, their needs are much higher. Like you said, it could be because of the cancer, because of the medication. So their needs are much higher, and at the same time, they could have increased losses through watery stools, diarrhea, or vomiting, or they could have, difficulty taking their fluids because of, like we said earlier, lack of appetite or bad taste. So every sip, every glass counts for them.
And I think that's an important point you're making there when you say every sip. You shouldn't be trying to take in a whole lot at once, particularly if you're feeling unwell, you're feeling nauseated, or having diarrhea. If you just put a lot in, you'll be a whole lot worse in how you feel. But those sort of small amounts steadily over the day may allow you to sort of catch up on your fluid needs and get you back to a balanced situation, right?
Absolutely. And taking small sip throughout the day makes it easier to tolerate for the patient to ingest and to digest it, and it'll slow down the intestinal transit, so it'll help for a better absorption of those liquids in the body.
So I guess at the other extreme, the patient shows up in the emergency and their blood pressure's down, and maybe they're a bit stuporous or semi-conscious because they're so far behind in their fluids, and you're really concerned. I think those are situations where physicians would logically start an intravenous and rehydrate the patient, and relatively more quickly to get them back towards normality. And there are various intravenous products that are available, but mostly you're trying to balance the water with salt and glucose to get the patient back to normal state as quickly as possible. And sometimes it only takes a few hours. Patients will sometimes come into the cancer center, daycare, maybe via the emergency department, and get a liter or liter and a half, 2 liters of fluid over hours, and then go back home, feeling very much better. It's remarkable to see how quickly people can respond to the fluids being infused. But I guess the area we're kind of interested in is the sort of in-between area where, they're still able to take things in orally, and you have special solutions that are helpful in that situation, or oral rehydration solutions, you'd call them. They even have a short form for it, ORS.
Yes.
We always have to have an acronym for everything in medicine. But maybe tell us a bit about the oral rehydration solutions and what's the benefit of them, and what do they contain?
Yes, and that, I think you explained it very well. It's really the in-between situation when patients can be mild to moderately dehydrated. So they could take oral rehydration solutions at home, and basically oral rehydration solution is a solution that contains a very specific amount of sugar, so glucose for the scientific name, and salts and other electrolytes. When I say electrolytes, I'm talking about certain minerals such as sodium, chloride, and potassium, which are vital to the body, the good functioning of the body, and to maintain that hydrated state, the hydration. And especially those can be lost during diarrhea, vomiting, for instance. And so these solutions contain a very specific proportion of all these ingredients, and they are based on expert recommendation. There's a lot of scientific literature and research that is proving their efficacy to rehydrate. So really, those solutions can help prevent dehydration, and they can replenish fluids and electrolytes in the bloodstream. And they work in a very specific manner where the perfect proportion, as I was saying, of sugar, which is glucose, and electrolyte, which would be the sodium in that case. So when you have those two nutrient in the perfect concentration, it allows for the body to absorb more efficiently the water. So even if someone is having diarrhea, the glucose will act a bit like a key lock mechanism, will unlock the door, and the sodium, the salt, will enter. And what follows salt? The water. Water always follows the salt. So this mechanism of action, this key lock mechanism, is very specific and is the most efficient way to absorb water and rehydrate and bring the fluids from the gastrointestinal tract into the bloodstream, therefore achieving rehydration. So bringing more volume in the blood, hence, so that would make the patient feel better. Like you said, that would be the stage before the IV fluids from the hospital. But like you said, after a couple of hours, when we're rehydrated, we already start feeling better. So in a nutshell, that's that would be the key to remember about oral rehydration solution, is that they work even if the patient has a very acute or severe diarrhea. this mechanism, the key lock mechanism, will still work. So it could be very convenient way, a simple and very efficient way to rehydrate at home when a patient is having very severe side effects.
And it's important that there be an option like this for care in the home. Particularly these days, it's so hard to get into hospital. Or if you come to hospital and you come to an emergency department, you might wait for a considerable period of time. You might end up getting intravenous hydration and then be confined to the hospital even longer. Having an oral rehydration solution that works by this mechanism may be a good way of helping to keep people at home and out of hospital, and hence a benefit. And it's important for people to recognize just how important this is in terms of getting the right balance of sodium, potassium. Too much or too little sodium can lead you into situations of loss of consciousness, seizures, and so on. The same token, a low potassium is very necessary for muscle function, can just make you very lethargic and lose your strength. And a high potassium can actually stop your heart. So getting the balance of sodium, potassium, and so on right in your system is absolutely critical. And I think that the replenishment, rehydration solutions also sometimes contain some other elements like zinc and some prebiotics. Can you talk a little bit about that?
So yes, sure. And like you were saying, the electrolytes that we mentioned earlier, the sodium, the chloride, the potassium, are all things that we normally ingest through our food and beverages. And in the occasion where a patient is sick, in sickness or in diarrhea, vomiting, we tend to lose all these electrolytes, and zinc is also one of them. Zinc is found in the food that we eat, but when someone has a more severe diarrhea, they could lose more zinc, and zinc can also play a role in the absorption of fluid and electrolyte as well. And when choosing an oral rehydration solution, another interesting nutrient that someone could look for on the label could be prebiotics, because when we are sick, when we have a lot of diarrhea or vomiting, it could create an imbalance in the good bacteria of our gut, the probiotics. So consuming prebiotics, so prebiotics is actually the food for the good bacteria. So when consuming prebiotics, it promotes the growth of good bacteria back in the intestine. So that could be an interesting ingredient to have as well.
Excellent. Now, there are a lot of products and a lot of drinks out there. Some of them are called energy drinks. If you watched any of the NFL football on the weekend, you see people being rehydrated as they come off the field. Now, are those products different from the oral rehydration solutions we're talking about here? What's a patient or a family member going to look for to distinguish themselves from those other types of products that are commonly marketed?
Right. So, and I think, again, just reinforcing the fact that at the beginning we were saying that all types of liquids are good, especially for cancer patients. Anything that will go down well, be well tolerated, will work. But in the case where there's a more acute situation or more severe side effects, such as diarrhea and vomiting, then the use of oral rehydration could become handy to avoid, like you were saying, getting to a state where you have to come to the hospital and get IV fluid replacement, which would also could delay even the treatments. So in a case when you really want to rehydrate your body, especially in the context of sickness and more severe side effects, then, like I said, the oral rehydration solution have this perfect proportion of glucose and sodium that will open the door for the cell to absorb the water into the blood. So when we're looking at other types of beverage, such as juice or sports drink or soda, sometimes that people will take when they feel sick, well, they're good for hydration, for regular hydration, I would say. But if you really want to rehydrate your body, then they don't have the right proportion or this perfect proportion that scientific have designed to actually rehydrate the body and to open this lock. They don't have the right key, basically, the right amount to open the door and helps the water entering the cell. In fact, having too much sugar can actually draw more water from the blood into the gastrointestinal tract, and that could even worsen the diarrhea by osmosis. So I think, I don't know if everyone is familiar with osmosis, but when you have, more molecules on one side and very few on the other side, the body will always want to have a balance on each side. So if there's a lot of sugar in your intestinal tract because you're drinking something a little bit more sugary, then your body will want to equilibrate the concentration and will actually draw water from your blood into your intestine, which is not what we want. We want the opposite. We want the water to come inside the bloodstream to feel rehydrated, to feel re-energized, to push the fluid and the electrolyte inside the blood. So those beverages are good for everyday hydration, but if we're really looking for this mechanism of rehydration, then it will be less efficient than an oral rehydration solution.
So what is a patient or a family member going to look for when they go to try and get a product that's got this perfect balance? What will be on the label without naming a product by name? How are we going to identify it?
Well, I think first of all, they should go in the pharmacy section, in the illness section of the pharmacy, where you have all the Tylenols, all the types of medication that you can buy in the section near the pharmacist. And usually in those pharmacies, you'll have more of a gastrointestinal section, with some other medication as well. So in that section, usually those are the products that a patient would look for. So it's really an oral rehydration solution containing ideally potassium, zinc, and if possible, prebiotics. Those would be good ingredients to look for. They usually come in the liquid form, so you can buy a bottle, or they also come in powder, for which it's really important to follow the mixing instructions, because if someone doesn't put the right amount of water, put too much or too little, again, we're not going to have that mechanism of action, that key lock mechanism that will bring the water inside the blood. So that's very important to follow these proportions. And also, if using the liquid or the powder, not to put more water than required, or not adding ice cube to it, because when the ice melt, it will dilute the solution. And again, we're losing the perfect proportion, if you will. But one of the trick, and we were mentioning this quickly earlier, to take small sips. So it's easier to consume in very small sips throughout the day. Again, will help for tolerance and for absorption of all those nutrients. And another trick to achieve that, it would be to make ice cube out of the product. So taking an ice cube tray and pouring the oral rehydration solution in it to make ice cube out of the solution, but without adding more water. So that's another trick, I think, that can be helpful to patients as well.
So I take it from that probably, as well as looking in a particular section of the pharmacy, you might just go ask the pharmacist or ask the dietitian about the products they would recommend by trade name, perhaps, and make it easy.
Absolutely.
Look, we're going to take a short break now, and we'll be right back in a few minutes. But we want to hear a brief word about the Cancer Assistance Program. So we'll be back talking further about dehydration.
We'd like to take a moment to thank our generous supporters, the Hutton Family Fund and Banco Creative Studio, who helped make the Cancer Assist podcast possible. The Cancer Assistance Program is as busy as ever, providing essential support to patients and their families. We remain committed to providing free services for patients in our community, including transportation and equipment loans, personal care and comfort items, parking, and practical education. These services are made possible by the generosity of our donors through one-time gifts, monthly donations, third-party fundraising, corporate sponsorships, and volunteer opportunities. Visit cancerassist.ca to see how you can make a difference in the lives of cancer patients and their families.
We're back talking to Sarah-Eve Loiselle about dehydration, and we've been talking about it with oral rehydration solutions that can be used sort of in that intermediate phase between where a person is just having a little bit of thirst and can look after themselves pretty well, or on the other extreme, they're requiring IV therapy. There's an in-between place where they're pretty seriously dehydrated, and these oral rehydration solutions have a great balance of glucose and electrolytes, sodium, potassium, in order to get a person back to a balance. And we've been talking about that and how to access them. We want to talk now a little bit about sort of the terminal care phase. Often, as patients are passing, they can't take in much in the way of liquids. They may be in a hospice, they may be staying in home as long as they can, but the family gets quite concerned because they see that they're not taking in fluids and they're maybe getting a little confused. Their mouth looks parched and dry. They're not moving around very much, and maybe they have a few myoclonic jerks, which are disturbing to see, these little jerking motions of the arms, sometimes the legs. And it's sort of a question whether to do something or not. And I guess there's a debate about whether to hydrate or not to hydrate. Mm-hmm. Hydration could be argued that it would be helpful if the person's conscious to reduce the feelings of thirst, to maybe make the myoclonic jerking go away, to enhance their alertness. And this might be a place for the oral rehydration solutions, one would think. Wonder what your thoughts are on that, Sarah.
I think as a former healthcare professional, I think the most important when it comes to end of life for patient is really to do anything we can do to enhance their quality of life. So how do they feel? If they are able to take something by mouth and they wish to take something, no matter what it is, I think, whether it would be an oral rehydration solution, but also maybe ice cream or candy or another drink, I think that's the most important, is really to trying to accommodate, what they want and how they feel. And if they are awake and able to take something by mouth and they wish to take something, in that case, they could, it would be I would want to offer them actually what they want, what they feel like having. That's what I would do. And if they want something like oral rehydration solution to feel a little bit better, that's fine. But I think any liquid, frankly, that they wish to take would be a good option.
I think that's a great answer. We always have to think, what is it the patient wants?
Exactly.
Not necessarily what we think's best for them. Particularly the terminal phase of life, really sensitivity around what's keeping the patient comfortable.
Mm-hmm.
Now, there's a certain element of keeping the family comfortable too, because the family witnessing the passing of loved one is a very stressful, emotional, upsetting time.
Of course.
And to have memories of your loved one with parched lips and asking for fluids, right, etc., is a bad image to live with after your loved one has passed. And so again, it's also being conscious of what's probably best for family along with the patient to try and ensure that the passing is as easy as possible and that memories are as good as they possibly can be. So hydration may play a role there as well.
Yes.
And it's difficult. It's kind of an individual, person by person situation that has to be thought through. You don't want to prolong suffering by hydrating unnecessarily, but you also don't want to have a conscious patient suffering with thirst and other symptoms of dehydration. So it's a delicate combination of factors to balance. That's when dehydration management gets really complicated, isn't it? Well, I think we've had a good review of dehydration and what can cause it and the mechanisms that the body uses to try and regulate it, and then what we can be doing to help the patient who's at various phases of dehydration, from very mild to intermediate to quite severe. And I suspect that this has been helpful to many people listening, and I really appreciate your expertise and what you brought to the conversation today, Sarah. It's been great. Any final words you'd like to leave our listeners with?
Thank you, Dr. Evans. It was a real pleasure, really, to be talking about this topic. And I think I would go back to the beginning where I said every sip count. I think as a nutritionist, a registered dietitian who used to work with cancer patients, I would tell my patient every bite count, every sip count. Like if you take one more bite or one more sip, it can make the difference if you add them all throughout the day. So I think that's what I would leave our listeners with, every sip count, and to pick your beverage of preference so that you are enjoying taking it and able to take it. But it's not always easy, and I know juggling with dehydration, with all the side effects, some periods are harder than others, and I really hope that our conversation was helpful to the listeners.
Those are great messages to leave our listeners with. Thank you for that, Sarah, and it's really been a pleasure, and all the best to you, and thank you for contributing to the Cancer Assist Show. This is the conclusion of the show for today, but there'll be another podcast in another month's time, so stay tuned. Bye for now.
Thank you for listening to the Cancer Assist podcast. Find more episodes, resources, and information at cancerassist.ca, or follow the Cancer Assistance Program on Facebook, Twitter, and Instagram. We'll see you next time.